Welcome. I am Claudia Clars, and this is Oria Document. Today, I will tell you Emma's story. I don't know if a story ever truly begins where we later remember it starting. When Emma was young, she never thought she would end up working in a place where science and human fear would come so close together. She arrived in Africa in the early 1970s as a researcher. Back then, everything seemed simple. She was part of an international health program. Their task was to study animal origin viruses, collect samples, and understand which pathogens were circulating in nature. Emma later said, "Back then we believed the world was understandable. We just hadn't seen all the pieces yet." In the first months, nothing seemed unusual. Forests, small villages, temporary clinics, dusty roads. People were sick, yes, but that was not surprising. Malaria, infections, well-known diseases. Then something changed. A young man was brought into one of the clinics. Emma was there not as a doctor but as a researcher, yet she had to stay because the case did not fit any known pattern. The man did not have malaria, not tuberculosis, not any classic infection, something else. It was as if the body was slowly giving up on itself. The next day, another case, then another, and another. Emma later recalled, "There was no pattern, at least not one we could see at the time. We only felt the same absence repeating itself." At the research station, they began comparing human cases with animal samples. They examined viruses from primates, and that's when the first real rupture appeared. One sample, a virus that was very similar to a human infection, but not identical. In the lab, they checked it again and again. Because the similarity was too strong to ignore, but too incomplete to confirm, it was the same thing. The years passed slowly, and meanwhile, the world behind them was changing too. The number of patients increased. Clinics became overwhelmed, but there was still no name for what they were seeing, only cases and questions. Then, in the early 1980s, everything changed. A new word appeared in the news: AIDS. Emma remembers she didn't even understand at first why this name mattered so much. Then she realized, because once something has a name, it is no longer invisible. Hospitals changed overnight. At first, everyone wore masks, not because they were sure how it spread, but because they were not sure of anything. Uncertainty became the new protocol. Emma later said, "The mask was not just protection. It was also a signal that we were afraid." As time passed, it became clear that the disease was not airborne. This changed many things, but it did not reduce fear. It only transformed it. In the clinic, conversations were no longer purely medical. They became explanations, theories, assumptions. Some said it was natural. Others believed in artificial origins. But Emma, who was there every day, saw something else. The virus did not argue. It only operated. The number of patients kept rising, and with it, the feeling of helplessness grew. There were days when new cases arrived every day, and still no certain answer about how to stop it. Emma later said, "The hardest part was not the disease. It was knowing something was happening, but not yet understanding what it was." Years later, science slowly began to assemble the picture. Genetic studies, comparative analyses, epidemiological data, everything pointed in the same direction. The virus did not appear suddenly. It was not artificially created. It was the result of a long biological process, crossing from the animal world into humans. But by the time this became clear, the story had already taken on a life of its own. Because the world does not only seek data, it seeks meaning. For Emma, the most important realization did not come in a laboratory. It came in hospital rooms, watching how people reacted to fear, how they tried to hold on to anything that gave meaning to what was happening. And now, decades later, when she looks back, what remains is not the virus, but the people, trying to understand something too large to immediately comprehend. Because in the end, what matters is not how an epidemic begins, but what it does to people while they try to understand it.
This was Oria Document, and I was Claudia Clars. If you enjoyed this episode, share your thoughts or reflections with us. For more content, please subscribe. Thank you for your attention.
We will meet again soon. Until then, I wish you all the best.